Patient is Mrs. St. Clair, 68-year-old male that came into the office with complaints of right hand pain, that he can't grab or hold on to things and he keeps dropping things. History of present illness is a 68-year-old male complaining of right hand pain and weakness. Onset was about 3 months ago. Location is the right hand, wrist, and center of the hand. Comes and goes. It describes it as achy, shooting pain from the wrist into the fingers. Aggravating factors are using his hand too much, and relieving factors are rest, ice, and Tylenol extra strength 1,000 milligrams every 4 hours as needed. Treatments are Tylenol extra strength 1,000 milligrams every 4 hours as needed. Severity reports it as an 8 out of 10. Denies any recent falls or traumas. Medications, he takes over-the-counter Tylenol extra strength 500 milligrams times 2 tablets every 4 hours as needed for about 2 weeks for the right hand pain. No prescribed medications. No known drug allergies. Medication intolerances include Advil and ibuprofen. Reports a stomach ache. Past medical histories, right hand pain times 3 months. No chronic illnesses, major traumas, or hospitalizations or surgeries. Patient is a tailor for about 30 years, and upon review of systems, musculoskeletal was all intact, other than the decreased the weakness in the right hand and weakness in the right arm. Neurological, he does report unilateral weakness in the right hand, reports shooting pain from the wrist to the right hand, trouble grasping and holding onto things with the right hand, started about 3 months ago, from the wrist in the right hand to the center of the right hand. It's intermittent. He reports it as achy shoots from the wrist to the fingers, aggravating too much usage, relieving his rest, ice, and Tylenol 1,000 milligrams every 4 hours PRN. Severity is about an 8 out of 10. Reports it impacts his daily work and lifestyle. Reports it hurts to open and close the hand. Reports tingling. Denies throbbing. Denies any imaging or seeing a doctor previously for this. Upon assessment, vital signs were within normal limits, and his Phelan's test was positive. His Tinel's test was positive, and his pinch test was positive for pain in the right hand and decreased strength. Sensation was equal bilaterally. Upon assessment, my assessment differential diagnoses include carpal tunnel syndrome, cervical radiculopathy, and peripheral neuropathy. My final diagnosis is Mr. Sinclair, whose occupation is a tailor, involves repetitive hand movements, faces a higher risk for developing carpal tunnel syndrome. His current symptoms are consistent with carpal tunnel syndrome, including the weakness in the right hand, tingling, and the pain radiating from his fingers. And it's consistent and it improves with rest but escalates with activity. Also, the Tinel's test, pinch test, and Phelan's test reporting reduced strength in the same hand and also producing pain seems to correlate with this diagnosis. I would recommend conservative treatment options first, including wrist splinting, and although NSAIDs are helpful in this, I would not recommend that, as the patient is intolerant to it. So I would recommend continuing Tylenol extra strength 1,000 milligrams every 4 hours as needed to effectively manage the pain. If that did not effectively manage the pain, we could look into naproxen or something of that sort. But I would also recommend physical therapy and occupational therapy to go ahead and do wrist exercises. And I would recommend a nerve conduction study and ultrasound to definitively diagnose or rule out other possible conditions. And I would educate the patient that the relationship between his work activities and implementing ergonomic practices can aid in symptom management. We should emphasize the value of taking breaks and resting in between hand exercises and engaging in those hand exercises to increase mobility and build strength and to prevent symptom progression.